Hello everybody, my name is Jenny. Welcome back to my YouTube channel. In this installment of our methamphetamine series, we're going to be talking about actions that you should take for the parturient. This is going to be quite a bit shorter than some of our other videos. So, benzodiazepines and a pregnant person. Back in the 1960s, there was a study that says you should not give benzodiazepines to any pregnant women because of cleft palate, risk of heart defects, etc., etc. And ever since then, people have been kind of too afraid to give benzodiazepines to pregnant women, so they just haven't. There's some other researchers that have come out with studies that said that it's actually okay to give benzodiazepines to pregnant women as long as it's after the first trimester. And then there's even some discussion about whether or not you can give it throughout the entire pregnancy. So a lot of this stuff that we're going to cover today for our methamphetamine substance use disorder parturients is going to be a little bit more in the realm of hypothetical, is kind of what can be done. Again, these cannot be called guidelines and precautions, and I know that gets a little bit confusing based on some of the other slides from the other lectures you've seen. Guidelines and precautions have this massive amount of data to support one way or another what a person should do. For methamphetamine, there's just not that kind of information out there. So the best that we can say is that these are practice considerations. So I'm going to give you the information based on the literature review that I've done, and then you can kind of make your own judgment on how to move forward. Maternal anxiety, as we know, impairs uteroplacental perfusion. Anxiety may actually be worsened if you gave the pregnant mother benzodiazepines. There's also a Dutch study that indicates that you have an increase of behavioral problems with the infant if you had a mother who had maternal anxiety. Now that's kind of a bit of a stretch. Are we talking about maternal anxiety because of methamphetamines? Does that increase anxiety? Yes, yes, yes. And then also, do I really care about behavioral problems when we've already put on the table something about heart defects and cleft palate and so forth and so on? It's not the be-all, end-all, but it's just kind of something to be aware of that other people are looking at these things. Now, the thing that we really worry about with giving benzodiazepines, of course, in addition to the cleft palate and the heart defects, is if you're imminently delivering, are you going to be running the risk of a floppy baby? What this means, of course, is that any benzodiazepine that you give the mom will go into the baby, and then because of the pKa changes in bioavailability, you'll get trapping, and then there's a higher concentration of benzodiazepines in the baby, which indicates that newborns, if you give the mother benzodiazepines, might have 3 to 4 times the level than compared to the mother. However, if you give the mother 0.02 mg per kg of benzodiazepine, there's no difference in APGAR scores. But what does that look like, right? 0.02 for somebody who weighs 75 kilos is 1.5 milligrams. That's not even really a full dose, and especially when we were talking about giving benzodiazepines up to the level of 20 milligrams for some of our other methamphetamine patients. I still want to implore to you that these are patients that you're not going to want to physically restrain, which is difficult, because if you have a mother who's coming in to the OR, usually it's a very tense and urgent situation. In my practice, I've seen mothers who have come in with breech babies, maybe an arm is sticking out or whatever. We're doing an emergent C-section, and or unfortunately, another thing that I've seen quite frequently, and the literature has backed up this experience of mine, is mothers coming in with placental abruptions, which either hasn't ended well for mom, hasn't ended well for baby, or hasn't ended well for both. So these are very high pressure, high tense situations. So at the end of the day, you got to do what you got to do. And that if you're worried about putting mom to sleep because there's a placental abruption and she's struggling, there's always that risk that you could put her into cardiogenic failure, but also you have, a minute, maybe sometimes less, to get the baby out safely to save that baby's life. So it's tricky, right? There's not a lot of great answers here. The other things that you can do other than benzodiazepines is Haldol. Haldol is a lesser pregnancy class of medication, so you can dose them with that medication as well. If you've reached your comfort level with benzodiazepines. So, unfortunately, I wish that I could give you better guidance for our pregnant patients. It's a very delicate situation. Again, this is what we have. We have information saying that benzodiazepines are not the evil that we thought they were. And then if you're not comfortable, then you can always give Haldol. So if you have a mom coming in for a little bit less of an urgent situation. Other than that, I wish you the best of luck with these patients, and I know that they can be challenging. Join us next time, and we'll kind of do another recap of our entire methamphetamine series. Thank you very much.